frustrations go back to normal and diminish. So thank you for coming, and thanks to the Navy League for having us, and I hope everybody will consider learning more about hyperbaric and joining this really crusade, this critical crusade to take care of America's wounded warriors.
Thank you. What Judge Maney doesn't mention is he's the gentleman who started in Florida the Veterans Court. So veterans who are coming out of these war zones they can't function mentally. They can't control their anger. They tend to self-medicate. They get into trouble legally. And Judge Maney has got Veterans Court so that veterans have a special opportunity. If they do something like kill somebody, they're in deep trouble, but most of the violent crimes. So I've treated special ops folks that were horribly injured, and their complete criminal record was expunged because we could demonstrate the before and after effects of hyperbarics by imaging the brain and some psychological testing. Let's go forward. Let's talk about your brain. We're worried about memory. We're worried about as we age. We listened to a number of excellent speakers yesterday talk about as we age, we start losing our stem cells. The viability of our stem cells as we age. Our stem cells aren't as viable or healthy as they were when we were younger, so we need to store them. And I can assure you that 60% of PET scans are false positive for Alzheimer's. In 1 to 2 hyperbaric dives, we find out that you have vascular dementia because there's a huge impact of hyperbaric oxygen on the brain. But I'm also dealing with some fairly severe brain injury. But there's more about hyperbarics than brain. We're treating NFL and NBA ball players who are coming to us for athletic injuries because you'll learn today that there's a huge impact of oxygen on healing just athletic injuries. But these guys that are in the NFL have hit their heads so many times, most of them are not cognitively working. Their timing is not so good. And as Judge Maney was mentioning, he was having a hard time completing sentences and all that. So hyperbarics has had that type of effect. Why aren't the effects of blast damage more obvious? Why is it that so many soldiers in the military seems to be oblivious to the effects of the silent wound of war? And why are high school kids getting hit in the head in sports? Their grades go down. We give them Tylenol for a couple of days for their headaches, and they're just never the same. One of the reasons that the effects don't show up is this is Alan, the computer wizard with his millions of dollars in research and brain. And that in the tweezers there is a piece of mouse brain the size of a grain of salt. And they were able to slice that brain 1/1000th the thickness of a human hair and calculate its computational ability. It was equivalent to 25,000 high-def movies. Our brains are much more endowed with synaptic things than a mouse. But just imagine, why are soldiers and NFL ball players walking around with significant damage that don't know it? Because we have so much power. And by the time you have these injuries, they become progressive. So soldiers are going to have early onset of dementia and Alzheimer's. We know our ball players, the NFL, there's all kinds of complaints about ball players now, and it's not being addressed, but hyperbarics is the answer. So concussions in sports, it's just like the military guys. Hey, you're a man, pick it up, get some smelling salts, and let's keep going. The damage to the brain, if you've injured your brain too many times or been exposed to too many blasts, and I've treated 18-year SEAL teams that fly in, some of them are active duty, and they keep saying from all the breaching and just the practices that they have being around blast, there's visible damage on diffusion tensor MRI of the white cells of the brain. Well, here is how we track the brain. We're using SPECT images, and if you notice on the left-hand side, the green, so the yellow color is it's a metabolic study of the brain, and the brain starts functioning better. So we have ways of imaging the brain. We do that as a baseline to start when a patient comes to us with complaints, because this gives us information. It's a lot more complex, but this is a general picture of how we're able to see what's going on. So what about you and your brain? How many of you have played sports and had been knocked out? How many of you have been in auto accidents? Most of us have had those kind of problems. And of course, we know our diet and all of the things that these conference speakers are talking about affect our brain as well. So some of the new things that are coming out about brain, they've got this gliovascular circulation. The glia is a type of cell within the brain. Your brain, 10 to 15% of your brain is neuron. The rest of it, the gorilla in the room all these years, has been the glia. And there's certain kinds of glial cells, and in the astrocyte is one in particular. But they're finding that this is a system that helps to drain amyloid B protein, which is the precursor of Alzheimer's, they think. So, and the other part is that there's a continuous movement of water throughout the brain. And we listened to the judge talk about he couldn't sleep. All of our veterans can't sleep. Most people with brain trauma can't sleep. And the astrocytes, a type of glial cell in the brain, actually shrink down at night so cerebral spinal fluid washes through the brain and clears toxins. So how sharp are you if you've had some reason to be up all night, and the next day, how quick are you mentally? We all know what that's like. So if it's due to injury of the brain, then, so here's a new system they're talking about, the glymphatic system. So the idea of the blood-brain barrier is losing, and now the new exciting thing is that at the Medical College of Virginia, they found lymphatic drainage of the brain. So forever, we were told the blood-brain barrier, that we don't have a lymphatic drainage system in the brain. We have it in the body, but why does the brain ever clear itself? So now, these were thought not to exist, but they're finding that this will be a second step in allowing the brain to clear and heal itself. So it's getting exciting about some of the research that's going on. For those of you, by the way, all of the things that I'm mentioning today, the back of this talk is loaded down with all of the science references, so I'm not trying to get too complex here. But aquaporins has part of how the water is flowing in and out of the brain. And hyperbaric oxygen has a major impact at this astrocyte input, that there's a little teeny artery there, and it's one of the most delicate parts of the brain. And when we get hit in the head, we get these microbleeds that add up over time. But just remember how powerful our brain is. So we walk around not really feeling the facts of these microbleeds until we get older and we wonder why we're just not as quick. Let's talk about another thing about a blood protein that they've noticed that people age differently. And so numbers of speakers yesterday were talking about why. Diet certainly related. But here is a study that was done with everybody was 38 years old, but some of the people biologically were 28 years old, and they went all the way to 61. So they think that there's a blood protein that's involved, and it's called B2 microglobulin. And so if we can find a way to get rid of this, we might improve memory and brain imaging. So the potential does exist for the reverse of aging. What about skeletal muscle in people as they get older and stem cell regeneration? So as we get older, we start losing, even from our mid-20s, and age is associated with skeletal muscle regeneration problems. So we don't come back from injuries, and we have a greater propensity for falls. The young muscle fiber looks like the top slide. The lower one is becoming more fibrotic, less elastic. So aged muscle is known to have a decrease in secretion of critical growth factors. And, but we know now that cell biology is determining that there are stem cells that persist throughout your life. And they are available to us if we have a right way of figuring out how to activate them. So Dr. Sears yesterday was talking about his research into exercise, and exercise is actually a way to keep our stem cells active, and not only for our muscles, but also for our cognitive abilities. So it used to be that we injected or gave stem cells in hope for the best, but now we know that you need to have targeted stimulation that will help these stem cells take and become more active. So besides exercise, there's electric stimulation that Dr. Parita also was talking about, lasers that can cause mobilization of stem cells. So these are the things that electric stimulation alone does. It increases blood flow, improves healing, decreases scarring, and you can double the contractile force of a muscle within 1 month of just electric stim alone. This is an article from the New England Journal of Medicine, hypoxia, which means lack of oxygen at the tissue site and inflammation. And they're talking about the link between inflammatory bowel disease, certain cancers, and infections as related to hypoxia. So this is actually a picture of a protein, hypoxia-inducible factor 1 alpha, and it's always shown around in the tissue at a tissue site where oxygen is low, hypoxic. It's also associated with redness, swelling, and pain. So the major discovery, according to Dr. Philip James, a professor of medicine in Scotland, is the effect of hypoxia-inducible factor in gene control. So when we have low oxygen at a tissue site, we have an effect on many different genes. And it's striking that a single molecule should emerge as a master regulator in two such disease and significant settings of hypoxia and inflammation. So lack of oxygen activates genes. It has to bind with its cousin, HIF1b, and when it's abundant, this doesn't occur. It's eliminated by a von Hippel-Lindau protein. So this is a cartoon that, for those of you that want more information about the actual effects of hypoxia and how this is a schematic on how this whole thing occurs. Low oxygen in tissues. I know that Dr. Mirage and others and Dr. Sears were talking about when we exercise incorrectly, we get less lung volume, and that means we don't get oxygen without pressure. But when we don't have adequate oxygen, these are some of the inflammatory things that show up. Inflamed tissue influences oxygen-dependent gene expression. So low oxygen causes you to activate genes that go in a bad way. So what is it about getting an increased oxygen in your plasma? Hyperbaric oxygen actually increases the plasma oxygen concentration, and we can raise that oxygen tension up to 2,000% at a tissue site. That's how the typical use of oxygen is healing wounds from diabetes and things like this. Again, here we are talking about lack of oxygen suppressing the immune system. Dr. Maharaj the other day was talking about downregulation of our immune system, and we need new stem cells implantations to upregulate it. Well, oxygen, hyperbaric oxygen, will upregulate your immune system. So tumors of cancer always have low oxygen levels. In breast cancer, the plasma oxygen concentration is 10 millimeters of mercury. When it goes, compared to 60 in a normal tissue, when it goes down below that, it's associated with death and metastasis. So in disease, white blood cells, neutrophils, are attaching to our vessels, and it creates extensive damage throughout the body. Hyperbaric oxygen prevents this. So we were talking the other day about inflammation. Well, this is inflammation. This is vasculitis, and where these white blood cells are creating this havoc and really, and this is Dr. Thom saying, based on a rather wide sampling of disease processes, inhibition of neutrophil attachment to blood vessel walls seems to be a common theme to the benefits of hyperbaric oxygen. So we help destroy some of these inflammatory processes that go on. This is Dr. Thom, a researcher, and a 2-hour exposure doubles your own natural stem cells, your CD34 stem cells. And if you do 20 treatments, you can increase them 8-fold. So we can make you grow your own stem cells, birth them. So one of the benefits, everyone's talking about getting your stem cells when you're young. Well, I'm not opposed to that. Of course, that's a good idea. But if you're my age, I missed the bus. So I do hyperbaric oxygen, and I birth my own stem cells. I feel alert cognitively. I don't have an ache or a pain. And so these are some of the benefits. One of the things is if you're ill and you've had a chronic illness for some time, your stem cells have been depleted because that's God's little repair kit. And your stem cells are depleted because you have a war going on. So if we have an 8-fold increase of 2 stem cells, is that as meaningful as an 8-fold increase in 50 stem cells? So dosing oxygen and understanding